expect a 25-year-old to start losing their eyesight, but by 31, Starzy Lee had become legally blind. The thing that caused her blindness is actually common in older people. Because of modern-day technology, a surgery with no downtime and no pain can give you perfect sight in just about 6 minutes. Here to tell us how the procedure works and who it works for, welcome board-certified ophthalmologist Dr. Colby Stewart and his patient Starzy Lee. Good morning. Dr. Stewart, when you talk about someone losing their eyesight, especially a young person, generally it may be because of disease and things like that, or even type 2 diabetes.
Right. When a young person, Starzy's age, comes into my office and said that they're losing vision, usually that means they need a pair of glasses or contacts.
Yeah, there's changing vision, which is different than losing
exactly,
vision.
changing vision, or maybe she's in there for, she wants to talk about LASIK and getting out of glasses or contacts. But when the more glasses or any type of prescription I tried to put in front of her, I just couldn't get her to see better.
Yeah. When we say legally blind, what does that mean?
Well, you hear people say legally blind a lot. They don't really understand what it means. Legally blind means that if you are 2200 and we put a pair of glasses in front of you, you cannot see any better than 2200, you're legally blind.
All right, Starzy, this had to be frightening because you start noticing your vision change a little bit, but then it got to that frightening point where it wasn't about a pair of glasses.
Right. About 6 years ago, they told me that I had a slight cataract in my right eye, and it just, progressed really fast. And, within the last 6 months, I needed something done.
Yeah, so good news, bad news. It's one thing when someone tells you you have a degenerative disease that we can't do anything about, but to say cataract, for somebody her age, that seems odd, but eventually all of us might have to deal with that.
It's odd, but it's actually a good thing.
Yeah.
Because when I can look in an eye, I start looking for reasons, why can't this eye see? Is it the lens, is it the cornea, is it the lens, or is it the retina? Usually if it's something in the retina, it's a little more serious,
right,
and the prognosis is not quite as good. So when I see a cataract forming or a significant cataract, it actually makes me a little bit happy knowing that we can treat this and then the prognosis is usually excellent.
What is a cataract?
A cataract is just a normal haziness of our natural lens. When we're born with a clear lens, and as we get older, it changes. And normally cataracts, are occurring in 65, 75-year-old patients. So it's really unusual to have somebody this young without any other medical problems, not taking, sometimes prednisone can give you cataract. So she didn't have any of these things. She just had, I guess, a genetic
Had anybody in your family had to deal with it?
My dad had cataract surgery about the age of 50. So, and my grandma as well.
Yeah. So. All right. So the causes, as you mentioned, can be aging, diabetes medicine, such as, oral prednisone and things like that, trauma to the eye as well. So in the olden days, how did we deal with cataracts?
In the olden days, a long time ago, they used to just push the cataract back in the eye and give a pair of glasses. We also, then later we made a large incision and we delivered the cataract out. You could actually see it and show the patient.
Yeah. Which, by the way, in medicine, the olden days could have been 2 weeks ago.
That's right. Nowadays, we're able to go in. I use a laser, which makes the incisions on the cornea. Basically, just with light, we're able to make the incisions on the cornea and break up the cataract into small pieces before even getting inside the eye. And then once the laser has completed that portion, then I go into the eye with a small instrument and gently suck out the cataract and then implant a new implantable lens.
Wow. Okay, so the total time that this is going on, are you aware of what's going on, Starzy?
A little bit.
Yeah. But it's not as crazy as it sounds. I think a lot of times people go, laser, oh no, but it's not as crazy as it sounds.
And Dr. Stewart made me feel really comfortable, and it was really easy. I
think that people, we're doing cataract surgery now, no needles, no shots around the eye, no stitches, and no patch.
Because literally after you're done, you open your eyes and
so I was able to see. I actually was like, wow, I can see.
Yeah, probably better than you did before.
Yeah.
Wow. So about 3 minutes each eye. Obviously, there's some pre-op work that needs to be done, right?
We do one eye at a time. So we'll do one eye, and then a week or two later, we'll do the other eye. In her case, I think we did the other eye in about a week, and because we wanted both eyes were bad. So once she had the worst eye done, she saw how much better she could see, and she was ready to have the other eye done.
Yeah. All right. So there's laser, and then there's blade-free LASIK, which I had LASIK years ago.
Right.
And people keep, people will come up to me and say, "Gosh, should I get it done?" And it's one of those things that I think a lot of people say after they finally decide to get it done, "Why did I wait so long?" It was amazing. I had 2015 vision after I was done. So blade-free LASIK. Explain who's a candidate for that.
Well, anybody that's nearsighted, a lot of people think that they can't have it because they have astigmatism, and you can have it. Usually patients under 45 or under 50 come in for a LASIK consultation, and basically what we're doing is we're reshaping the surface of their cornea to enable them to see better without glasses or contacts.
Yeah, and the alternative to LASIK is that implantable lens.
The implantable contact lens, that's right. For people who are really, really nearsighted and they're not in the range that LASIK can treat, the implantable contact lens is what we use.
All right, what's the first thing you read after you?
Street signs.
Street signs. All right. Well, Dr. Stewart has a special offer for Great Day Houston viewers. $1,000 off for callers who schedule LASIK surgery before April 30th. $1,000 off if you schedule before April 30th. For more information, you can log on to colbystewartmd.com, colbystewartmd.com, or call this number right here at 713-358-4340, 713-358-4340. Thank you. Well, they creep up on you slowly. At first, you might not mind one or two, but sooner or later, they earn their names, spider veins or varicose veins. Don't get rid of the shorts and dresses. Instead, get rid of the veins and other uncomfortable symptoms. We'll show you how next.